Meningitis is a medical condition characterized by inflammation of the meninges, which are the protective membranes surrounding the brain and spinal cord. The inflammation is usually caused by an infection, most commonly by viruses or bacteria, although fungi and other microorganisms can also be responsible. Meningitis can be diagnosed through a combination of physical examination, analysis of cerebrospinal fluid, obtained via a lumbar puncture, and sometimes imaging studies like a CT scan or MRI. Prevention of meningitis includes vaccination against certain types of bacteria and viruses that can cause the infection. For example, vaccines for Haemophilus influenza type B, HIV, meningococcal meningitis, and pneumococcal meningitis are available and recommended in many countries. If you suspect you or someone else may have meningitis, it is important to seek immediate medical attention, as early diagnosis and treatment can greatly improve the outcome. The symptoms of meningitis can vary depending on the age of the affected person and the specific cause of the infection. However, common symptoms of meningitis include sudden high fever, severe headache, stiff neck and neck pain, difficulty touching chin to chest, nausea and vomiting, sensitivity to light, photophobia, confusion or difficulty concentrating, sleepiness or difficulty waking up, seizures, skin rash, in some cases. In infants, the symptoms of meningitis may be different and can include high fever, excessive sleepiness or irritability, poor feeding or refusal to eat, bulging fontanelles, the soft spots on the baby's head, stiffness or floppiness of the body, unusual crying or whimpering, lethargy or decreased responsiveness. Meningitis can be caused by various infectious agents, including viruses, bacteria, fungi, and rarely parasites. Here are the primary causes of meningitis. Viral meningitis. Viral meningitis is the most common type of meningitis. It is typically caused by several different types of viruses, including enteroviruses, such as coccidioviruses and echoviruses, herpes simplex virus, varicella zoster virus, which causes chickenpox and shingles, and others. Viral meningitis is usually less severe than bacterial meningitis and often resolves without specific treatment. Bacterial meningitis. Bacterial meningitis is a potentially life-threatening form of meningitis. It can be caused by various bacteria, including Streptococcus pneumoniae, pneumococcus, Neisseria meningitidis, meningococcus, Haemophilus influenza, Listeria monocytogenes, and others. Bacterial meningitis requires immediate medical attention and treatment with antibiotics. Fungal meningitis. Fungal meningitis is relatively rare and usually occurs in individuals with weakened immune systems, such as those with HIV, AIDS, or individuals taking immunosuppressive medications. Cryptococcus neoformans and Candida species are common causes of fungal meningitis. Parasitic meningitis. Parasitic meningitis is uncommon but can be caused by parasites such as Naegleria fowleri, which is found in warm freshwater, and can enter the body through the nose and travel to the brain, causing a severe and usually fatal infection. Non-infectious causes. In some cases, meningitis can be caused by non-infectious factors, such as certain medications, autoimmune disorders, such as lupus or Behçet's disease, certain cancers, or chemical irritants. The treatment of meningitis depends on the underlying cause, whether it is viral, bacterial, fungal, or parasitic. Prompt diagnosis and initiation of treatment are essential to prevent complications and improve outcomes. Here are the general approaches to treating meningitis. Bacterial meningitis. Hospitalization. Individuals with suspected or confirmed bacterial meningitis are usually hospitalized for close monitoring and intensive care if necessary. Intravenous antibiotics. Bacterial meningitis requires immediate treatment with intravenous antibiotics. The specific choice of antibiotics depends on the suspected or identified bacteria and their sensitivity to antibiotics. Supportive care measures, such as pain management, fever control, and fluid replacement, are provided to maintain hydration and manage symptoms. Corticosteroids. In some cases, corticosteroids may be administered to reduce inflammation and complications associated with bacterial meningitis. Viral meningitis. Supportive care. Viral meningitis is typically self-limiting, and most cases resolve without specific treatment. Treatment focuses on supportive care, including rest, hydration, fever control, and pain management to relieve symptoms. Antiviral medications. In some cases, antiviral medications may be prescribed for specific viral causes of meningitis, such as herpes simplex virus or varicella-zoster virus. Fungal meningitis. Antifungal medications. Fungal meningitis requires treatment with specific antifungal medications, such as amphotericin B or fluconazole. The choice of medication depends on the type of fungus causing the infection and the individual's overall health condition. Supportive care measures, similar to those for bacterial meningitis, are also provided for fungal meningitis. Parasitic meningitis. Treatment options for parasitic meningitis depend on the specific parasite causing the infection. It often involves specialized antiparasitic medications. Supportive care measures are also provided to manage symptoms and complications.